During the COVID-19 pandemic, it's vital that hospitals and health systems are equipped with personal protective equipment, PPE, to ensure the safety of their healthcare workers while providing care for patients. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Petterly, Senior Writer with AHA. In this podcast, AJ Rolle, Senior Program Manager at the AHA, moderates a discussion between Priya Bathija, Vice President of Strategic Initiatives at the AHA, and Dr. Ali Raja, Executive Vice Chair, Department of Emergency Medicine at Massachusetts General Hospital and co-founder of GetUsPPE. The subject, the challenges related to PPE, and the work that the AHA and GetUsPPE are doing to support hospitals in meeting their PPE needs. And now to AJ.
Thank you, Tom. And thank you, Dr. Raja and Priya, for joining us today to discuss the personal protective equipment, or PPE crisis, and your efforts to improve access to PPE for healthcare workers across the country. Dr. Raja, let's start with you. Can you tell us a little more about GetUsPPE and how this initiative started?
Absolutely, AJ. And first of all, thanks for having me on here and talking about GetUsPPE. It's been a labor of love for a bunch of us over the past few months. It all started back in March when a group of physicians started the hashtag GetMePPE on Twitter. And then actually a separate group, it was really interesting. We thought of the same sort of thing. How can we have a grassroots organization focused on getting healthcare workers PPE? And me and a friend of mine went out and bought the webpage GetUsPPE.org. And because of Twitter, we actually all found that we were focused on the same thing. And since we had the webpage, we decided to merge our efforts around GetUsPPE.org. And it grew pretty quickly. This was in early March. By March 20th, we actually had a website where healthcare workers could post their PPE needs and other people who had PPE, because you'll remember back then, Dr. Fauci and a bunch of us were really advocating that healthcare workers should get PPE, and we weren't advocating as broadly for everybody to have it because there just wasn't enough to go around. So we started this website allowing for people to post what they had to donate, kind of like a Craigslist for PPE. And over the next few months, we became a nationwide volunteer effort to get PPE to healthcare workers. And now we actually have the largest non-governmental database of PPE demand that's out there, with over 13,000 requests for PPE in our system. So we're the single destination for healthcare workers to register their PPE needs. We match PPE donations to those in need and deliver PPE to them, and this is really important, free of charge. We're a nonprofit. And just finally, it's important to note that our demand data was published in The Lancet just 2 months after we were founded back in May. And we are now really trying to focus on equity. We have a pilot algorithm that's built to equitably distribute PPE, and we're taking into account factors like the COVID vulnerability of a population that the facilities serve, and trying to really get PPE to these sites in a really equitable way.
That's really great work, and it's interesting to see that it just started as a kind of a grassroots movement through social media and just grew into this national initiative. Can you just briefly describe the types of organizations that have been requesting PPE?
AJ, it's really run the gamut, but has shifted a little bit over the past few months. Initially, it was large hospitals and health systems, and then even outside of health systems, large hospitals. But what we've found is that as the larger hospitals who have supply chain experts and really whole departments focused on this, as they've built up their own personal supply chains and the relationships that support those, we've now shifted, and a lot of our requests come from smaller and more rural hospitals, but also nursing homes, clinics, folks who don't have 10 people focused on supply chain management and are really reaching out. So the rural hospitals that serve critical access communities, that's where we're getting a lot of requests now, as opposed to the larger hospitals and health systems early on in the pandemic.
Thanks, Dr. Raja. Priya, can you tell us a little bit more about AHA's 100 million mask challenge?
Sure. Thanks, AJ. The 100 million mask challenge is a national call to action to increase production and supply of PPE for healthcare workers on the front line. Similar to GetUsPPE, our work started sort of from a grassroots effort from a hospital, Providence in Washington State, that was one of the areas hit by the COVID pandemic early on. They started a 100 million mask campaign in their community to get the public to help them meet their PPE needs. And they came to us and said, can you take this on and make it national? And so that's really what we tried to do. And we kicked it off in March. And since that time, we've created a number of pathways for hospitals and health systems to access PPE. And we started simple. We started by making available a number of specs and designs that could be used by manufacturers that wanted to start making PPE, whether that was masks, face shields, or gowns. We also designed a vetting process early on for resellers. As hospitals began to rely on non-traditional sellers of PPE, they could have some sort of sense of who could be trusted in this new PPE market. And then we went on to develop a donation platform called Health Equip with a number of partners, including Microsoft, Kaiser Permanente, Merit Solutions, and Kearney, to connect those individuals and organizations that wanted to donate PPE to hospitals that needed it. And now we're working on sharing a number of different procurement platforms so that hospitals can connect directly with vetted resellers and suppliers of PPE. Along the way of developing all of those pieces and parts, we also developed some other features. For example, we have our Protect the Heroes campaign, which provides a way for individuals to help support their local hospitals' PPE and other COVID resource needs. We've definitely built this over a very short period of time, but it continues to grow and reflect the needs of hospitals and health systems across the country, and to really be a great resource for not only hospitals, but manufacturers and individuals that want to try to find a way to alleviate the PPE challenges that we're facing.
Thanks, Priya. And yeah, it sounds like both AHA and GetUsPPE have really moved rapidly over the last 3 or 4 months to really support the hospitals and health systems in addressing this PPE crisis. And so, Dr. Raja, we know that PPE was a key focus back in March when the COVID pandemic began. And you talked a little bit about the different organizations that changed over the recent months. But can you share any other changes or differences that you've seen recently with regards to PPE and the COVID pandemic?
Absolutely, AJ. And as Priya mentioned, as you've said, this is still a real problem. There's a massive shortage of PPE across the country, even now in August when we're recording this. Between May and June, our nationwide requests for PPE at GetUsPPE rose by over 200%. So we've seen a continual increase in this, and we're tracking now to see what the rate was in July as we close out those numbers. As the supply chain starts catching up, as I mentioned earlier, some large hospitals are able to buy the PPE they need, at least for now, from trusted vendors, ideally working with teams like the one that Priya just described. But smaller hospitals and healthcare clinics and healthcare facilities in underserved communities still can't afford PPE. And we're anticipating over the next few months that as schools start reopening, and unfortunately, as COVID cases start climbing, which is inevitable, we all heard about the recent camp down in Georgia. When schools start reopening, we will start seeing more patients with PPE, and the schools, the healthcare facilities will start needing more PPE. Finally, one of the biggest things that we've been trying to focus on, as I mentioned earlier, is making sure that we do this in the most equitable fashion. We've found that Black communities especially are suffering from PPE shortages. And we've started a separate fund, a PPE for Black Lives Fund, on our donation page. Our original goal was to provide non-medical grade PPE for protesters. But now we're actually shifting those funds to frontline workers in Black communities. And that's our real focus right now, is to make sure that communities that are especially suffering from PPE shortages are where we're focusing.
Thanks, Dr. Raja. Priya, can you also share what the AHA is seeing from a hospital perspective?
Sure, AJ. And, over the course of the last 5 months, we've seen the needs for PPE change drastically. And they've changed over the country as different hotspots come up. And in March, when the pandemic began, the initial need was really around respirator N95 masks. And then as a country, we began to address those needs and find solutions, whether that was finding new manufacturers to make the N95 masks or finding ways to decontaminate the N95 masks. But because we were able to find solutions, the need shifted and we started to see a larger need for surgical masks. And then for a large part of the spring and early summer months, we were seeing large shortages of gowns and gloves. So today, overall, as Dr. Raja alluded to, for many hospitals and health systems, the PPE availability appears to be better. Some of the larger hospitals have been able to go back to utilizing traditional sourcing channels, so they're not required to use some of the non-traditional channels that have popped up over the course of the last 5 months. But it's important to note, and I'm really just echoing what Dr. Raja said, that even though it's better, it doesn't mean the problem is solved. We do still have a massive shortage in PPE, and the supply of PPE isn't uniform across the country. So we're still seeing PPE in some areas that need it most as they face increased numbers of cases. And with cases on the rise, with schools reopening, I think this PPE challenge is with us for a long haul as we move forward. Right now, today, our hospitals and health systems have identified that masks remain the number one product shortage. This includes both N95 and surgical masks. In addition, they continue to say that gowns are a problem, and they are seeing significant price increases for gloves. And then, like all of us, our hospitals are continuing to face shortages obtaining disinfecting wipes. So just like we can't get them when we go to the store to find them, hospitals are having that problem as well. We're also hearing more demands for shoe covers and HEPA air filtration systems. So really facing a variety of challenges tangentially connected to PPE. I do want to take a pause here, though, and just share that not all of the PPE story has been bad or doom and gloom. We've seen so many individuals and businesses come together to help and to really find any way that they can offer their assistance. So we've seen people across the country using 3D printers to assemble face shields for hospitals. I read a story about a 7-year-old boy in Missouri who was the son of a nurse, and he used a 3D printer to make hundreds of adjustable headbands that could be used to hold protective masks in place more securely. Schools and others across the country have donated surplus medical supplies. A number of clothing retailers have started producing PPE to protect the healthcare workforce. One of my favorite examples is the National Bobblehead Museum in Cleveland, Ohio. They have created bobbleheads of Dr. Fauci and Dr. Birx, along with some of the governors who were more proactive in taking on the pandemic. And they've committed that $5 of each sales would be donated to our efforts on PPE. Right now, they've been able to donate close to $300,000 just from sales of those bobbleheads. So even though we're dealing with some pretty tough challenges now and as we move forward, it really is inspiring to see that so many people and organizations across the country are working to help keep our healthcare workforce safe.
Thanks, Priya. And it's always good to reflect back and look at the successes and really see all of the different organizations that are helping to support hospital health systems and healthcare workers in general. So a follow-up question for the both of you, and you both briefly talked about some of the future challenges like schools reopening and the continued increase in demand. But do you have anything else to add about future challenges that you anticipate related to PPE as the field continues to take on COVID-19? And Priya, let's start with you, and then we can go to Dr. Raja.
Yeah, one of the challenges that I think we're going to see as we move forward is that we're actually going to face a shortage in the materials that are used to make PPE. So this could be the fabrics or other materials that are actually used to make masks, gowns, and gloves. Right now, we're hearing that some of the materials used to make masks will be in short supply in the upcoming months. And we're hearing the same about non-woven fabrics that are used to make gowns and shoe coverings. in anticipation of some of those shortages, we're proactively working with those that have expertise in materials and materials management to see what options may be available as we move forward. And I know that there are a lot of universities and others doing research on that as well. And then outside of PPE, I think we're going to face some other challenges related to a shortage of materials. So that includes materials that are needed for testing, like swabs and reagents, as well as the materials we're going to need to actually distribute a vaccine for COVID-19 in 2021. So what can we do now to make sure that we have the syringes and alcohol wipes and other things that we'll need to actually deliver the vaccine to individuals? So we are hearing that hospitals are now beginning to evaluate those needs, and we anticipate that as an association and as a country, we may have some work to do on that front as we move into the future.
Priya, I couldn't agree more. I think that you've nailed a lot of the real upcoming issues we're going to have. Although I want to point out one that you left out, and that is specifically that I just went to the Bobblehead Hall of Fame's website, and they're already out of the blue tie version of the Dr. Fauci bobblehead. And now they're only left with red ties. So there's another supply chain issue that is clearly going to be a problem that we need to discuss. And this is wonderful, by the way. And you're absolutely right. They're donating $5 to the AHA Protect the Heroes campaign and 100 million mask challenge. And I am going to order one of these as soon as we're off the podcast.
That is amazing. Mine actually has been delivered, but
with the blue tie, I'm sure.
Yeah, blue tie.
That's
so
going to be a collector's item.
Very exciting to have Dr. Fauci, with me as we go through this PPE crisis every day.
Absolutely. And I'm going to get one of Dr. Burke's as well. And on a more serious note, everything that Priya said was absolutely right. We are going to see broader demands of PPE beyond masks. And as Priya mentioned, that's already happening in everything from shoe covers to gowns. This is also going to increasingly become an equity issue. It's already become one. But over the next few months, communities that have had unequal access to healthcare will continue to be disproportionately affected by PPE shortages and less able to afford PPE. But this is going to extend beyond the healthcare facilities in these communities. It's also going to extend to the schools in these communities, to the daycares in these communities. The communities that are disproportionately affected will need PPE at multiple sites and buildings as the school year begins. And it's just going to be exceptionally difficult. This is also just the time of year when we start seeing things like forest fires, like the ones that are already ongoing in Southern California. We start seeing hurricanes. And for example, we recently had a request from a large hurricane shelter in Texas that's currently housing COVID positive and non-COVID positive people together. And they have very little PPE. One large shelter, the one that I just mentioned, had less than 1 day's worth. And so hurricane shelters in Florida, in South and North Carolina, beyond the typical medical hospitals and clinics that we've been seeing, we're going to see schools and shelters and others needing PPE that we're going to need to help and focus on as well.
Dr. Roger, I just want to stress the point you made around this becoming an equity issue. And, we've spent a majority of our time today talking about healthcare workers, but I appreciate you highlighting, schools and daycares and other organizations and individuals that are going to need this PPE as we move into the fall and winter. One other group that really needs access to PPE that I think is often not part of the conversation are the farm workers. And these are the individuals who are working on the farms to ensure that we all have food on our tables to eat throughout this pandemic. And there has been a tremendous shortage around providing masks to those workers. And then also just marginalized communities generally. So, for example, how do we get masks to those that are homeless, and not only getting them access to the mask, but once they have it, how do we ensure they know how to use it, how to wash it, how to make sure that they aren't going into situations that could increase the spread of virus for themselves and others. And so there is a lot more to be done outside of just providing PPE for healthcare workers, but so many ways that so many different organizations have started to take the steps needed to get there together as we go into the fall and winter.
Great point, Priya.
Thank you, Dr. Raj, and thank you, Priya. One final question for both of you. And, we've talked about the challenges and the great work that each of our organizations have been doing to address the PPE crisis and support our healthcare workers. But can you both talk about any plans to work together to address this collectively? And Dr. Raja, we can start with you and then go to Priya.
Absolutely, AJ. And it's important to emphasize that this isn't a competitive space at all. We're all focused on the same goal. And our goal is to get PPE to healthcare workers, to the community, to anybody who needs it to prevent the spread of COVID. And the more people that are working in this space, the better. For example, right now, GetUsPPE leadership participates in monthly calls with collaborative stakeholders in the PPE space to share new ideas and innovations. And I know that AHA leadership is on those as well. There's a number of groups that are collecting information from healthcare facilities about their PPE needs. We're working with the AHA because we really need to standardize the questions that we use to facilitate data sharing and collaboration. If we're all asking different questions, people are just going to get confused and quite honestly aren't going to be willing to answer multiple surveys if they're all very different. And then finally, we're really trying to broaden our mission to focus on getting PPE, as we mentioned, as Priya mentioned earlier, to the people who need it most: hurricane shelters, schools, small rural clinics. And we're really hoping to partner with organizations like the AHA to amplify our impact. I'm really involved with the Massachusetts Health and Hospital Association, and I haven't done much work with the AHA nationally, but I know our organization has. And the AHA's reach is unparalleled. And so we'd love to partner more to amplify what we're doing and to work together.
And Dr. Raja, we would love to do the same. I think it's been one of the best things that we've done so far through the 100 million mask challenge is to come together with organizations like GetUsPPE and others in the space that are working on these issues. Like you said, it's not a competitive space. It is a place that needs all of us coming together to increase our impact. And so we are participating in those monthly calls that you mentioned with others like Project N95 and the other health equip partners that I mentioned earlier on in this podcast. It's been really helpful to be able to come together and share trends and data around PPE and to just have the opportunity to convene and say, this is what we're seeing, these are where the shortages exist, and then working together to come up with solutions for how we can address those shortages. Another area where I see our interests aligning and us being able to work together to amplify the message is around a public campaign that we kicked off last week with the American Nurses Association and the American Medical Association. And that is a campaign that encourages individuals across the country to wear masks, wash their hands, and to socially distance. And I know that GetUsPPE has taken some similar efforts around getting the public to wear masks. So looking forward to having an opportunity to coordinate and collaborate on that effort too, because I think that is a message that really needs to be amplified across the country as we move forward.
That would be absolutely wonderful. Let's do that.
Thank you, Dr. Raja and Priya, for your time today. And thank you for the great work that you both are doing to help support hospitals, health systems, and healthcare workers address the PPE crisis during this COVID-19 time. Back to you, Tom.
To learn more about the work being done to support hospitals in addressing their PPE needs, please visit 100millionmasks.org or getusppe.org. Thanks for listening.